I'll now request, and I have the honor and privilege to introduce Professor Dr. Atul Kumar for the C.N. Shroff Oration Award. Professor Atul Kumar has really taken Indian vitreoretinal surgery to a great level, and we still remember he's my senior from modern school, then All India Institute of Medical Sciences, then we joined together as faculty, and he rose to be the chief of RP Center. But that was the time when we were starting new things in RP Center, so we were looking at phaco, and he was the master, I would say, for vitreoretinal surgery. A great teacher, great academician. Above all, I think he has taught so many people and has taken vitreoretinal surgery to a new level. I'll request Professor Atul to kindly let us know about his journey, his journey as regards ophthalmology. Atul.
Thank you, Maipal. Thank you, Partha. And thank you so much for all this nice introduction, and my good colleagues and friends. I'm just going to give you a short 10-minute brief interview, talk. I would be covering many topics, many parts of my career and my life, but just a few slides to show some of the few things which happened. So of course, as Maipal said, why do we all choose ophthalmology? Why do we choose as a life career? Why we choose that it's going to lead us to some, satisfaction in life? Because once you choose a particular branch in medicine, you stick to it. So it's medical and surgical, treating both wellness and disease. And also the very fact that it spans all ages, the range of the diagnosis is broad, the technology is breathtaking, innovation is constant, as I witnessed over these years. So that's why I just took it as a good option, I thought. So I was born in 1956, and as Maipal mentioned, my early schooling was in Delhi itself, in modern school, Bar Khamba Road, where Maipal was also there. So we were under the illustrious Mr. M.N. Kapoor, principal beyond words, and he kind of groomed us to be disciplined, proper persons, and also be very academic in our approach. I did my MBBS from Maulana Azad Medical College, and then moved on to do my junior residency at MD from RP Center. Then did my senior residency or registrarship from 1984 onwards in RP Center for 3 years, and then joined the faculty as assistant professor at RP Center. It was lecturer at that time, but redesignated. Finally, 2016 to 21, I became chief and professor at this particular institute. This is one of those early pictures where you can see Mahipal there also as a resident, Rishi on his right side, Auric on his left side, and Dr. Murthy is there, my wife is there, myself. Professor Madan Mohan, we used to adore a lot, recently passed away, then Manoj Rai Mehta. So this is a place where in RP Center, in the front where we used to have our dinners. Of course, it was a very nice place because we would all get together in a small area where the residents used to all get together, or the faculty. So my brother was also there, and so this is just to tell you, I jumped many decades and years and then became chief. So then we just inaugurated, when I became chief, the Plaque Brachytherapy Center for retinoblastoma, melanoma, which we didn't have before, and also the state-of-art retina center, the lab there, where we put in all the diagnostic and therapeutic machines, as well as a research lab for retina. So we got, in 2016, as soon as I became chief, I got RP Center reappointed as a WHO collaborating center, which we had lost before. And also conducted a survey on diabetic blindness along with the ministry in 2015 to 19, first of its kind, to assess the magnitude of DR in pan-India, entire India. Also took AIMS, RP Center basically to the top level hospital, and then a major milestone was my receiving it from the distinguished Dr. APJ Abdul Kalam in 2007, much before my chief, before I was even, I think, associate or professor, as a professor. So my Padma Shri, I think the same year, Padma Shri Mahipal had also got, and so did Anup Mishra, if I'm not mistaken. So anyway, then I got my FRCS at Edinburgh ad in Hominium from the president of the Royal College of Surgeons, Edinburgh. And then, of course, teaching has always been my passion, and one reason why I stayed on was to teach and train postgraduates in retina. And we used to have workshops and PG teaching series. And there was a ban on bevacizumab due to cluster endophthalmitis all over India. So the DCGI put a ban. So we got them to somehow talk to them and revert or call back the ban, or the kind of they put a ban on use of Avastin. Avastin is economically very viable for patients of our country. So with the DCGI, with the lobbying we did, I was one of the major factors, along with the others, Ajay Roda and a whole lot of other people, Dr. Vishali Gupta. We got this this ban, or you can say, the off-label use was banned by the DCGI. We got it reversed, and that's the reason why Avastin is still being used, though the company Roche doesn't allow it. It's written clearly in the instructions, not for ophthalmic use, but because of DCGI position being towards our side, we've been using it off-label. But of course, you need a consent. So these are few things. We did a 50th Golden Jubilee, very successful at the RP Center. Luckily, it fell during my career, my duration. So I've taught a lot of residents and resident-to-resident teaching. I've tried to simplify residents teaching and also written books on retina, comprehensive retina for medical and surgical management both. The latest edition is a 2022 edition, which has just got released. And make it simpler. I've treated a whole lot of distinguished people whom I've always adored, and now I'm continuing my work, because something not to look back is to continue my professional work and patient care, free from all other things. And this is the center where I work at Housing Enclave, and with my small team, and we are doing reasonably good work. And we use a digital Ingenuity system for VR viewing and VR surgeries. Basically a retina center with some cataract, but no refractive or cornea work. So this is the kind of work we are doing there. This is just from the screen, video from the screen of the 3D viewing system, the flat OLED screen. So just to tell you what all we are doing is right now. So we have a OT which is state of the art, and dedicated retina OT where only retina equipment is kept and no other surgeries are done. So I also got the BC Roy Award from the late Dr. Pranab Mukherjee, and he was a very great moment for me, because Dr. BC Roy is one of those distinguished ophthalmologists, doctors who was actually a great man, and he did wonders for India. And on his name, there is an award called the BC Roy Award. So I've also been the consultant to the Armed Forces for retinal diseases and surgery. And during the various terrorist activities, I've treated many trauma cases, which I'm really indebted to the Armed Forces. I've also delivered a couple of lectures to the Armed Forces Medical College at Pune on retinal disorders and traumatic retinal diseases and how to manage injuries. Learning never ceases. I've been a member of the APVRS Retina Committee, and these are with various pictures I've had with them. And this is the place where I now work. And these are high definition retina platforms where we take care of patients of all kinds, because learning and teaching never ceases. With this Professor MC Mishra, my former director at AIMS, who recently visited me for some eye issue, and Dr. Deepika Deka also visited me. She chose me for her eye treatment because she needed a lot of urgent eye treatment, which I'm continuing to do. And so I feel very satisfied that people previously also whom I've worked with, or who are my teachers or with me, colleagues, have looked up to me for their care. Thank you so much.
Thank you very much, sir. It was wonderful listening to you, and we thank you for the enormous work that not only you have done, but also that you have imparted to ophthalmologists in our country and beyond. Thank you very much.